There's this perception of Asians being a model minority. And so somehow there has been this belief that social determinants of health may be less impactful for Asian communities because they tend to have higher housing security, higher educational status, they live in higher income neighborhoods. So there's this perception that Asians do not really have the same issues with social determinants of health that other racial and ethnic groups have. And so what we tried to talk about is the fact that that's really not true. We know that there's significant differences in cardiovascular risk between different Asian populations. So South Asians, so those who come or originate from India, Pakistan, Bangladesh, tend to have much higher cardiovascular risk, whereas East Asian people who come from Korea, China, and Japan are at much lower cardiovascular risk. So we have seen this in the epidemiologic data, but what we don't know is why necessarily do these differences exist. So the purpose of this study and other studies that I do are related to trying to better dissect out why are there differences. Yes, we see trends that if you have more unfavorable variables, that tends to associate with higher rates of cardiovascular risk factors. What is unique about this study is that it looks at it from the lens of what does it do differentially to South Asians versus Chinese Americans versus Filipino Americans versus other Asians. So this has never been actually looked at before.